there's been a lot of talk about self-quarantine and isolation, and you had Doc talk about it as well, that if you know you have been exposed to anybody, that has either the symptoms or anybody that has been in contact with anybody that has contracted this virus, you should self-isolate. So what does it really mean to self-isolate?
Testing. So these are the people who are doing the work. These people, excuse me, these ones.
So let me take you through the self-quarantine guide. What it means is that it is a transparent self-restriction of a person's activities when they are not ill with COVID-19 for the purpose of protecting unexposed members of the community from contracting the disease should any at-risk person become sick. So essentially, you're self-quarantining because you know, even though you're not there yet, your exposure to the virus, somehow you want to watch yourself for like 2 weeks to make sure that you're not showing the symptoms or you don't have it. So that is what it means to self-quarantine. Keep yourself at home, and we'll show you a video that also explains a bit further of what you can do if you are to self-quarantine or self-isolate. So who should self-quarantine? Travelers coming from the countries or territories, areas with active transmissions of COVID-19 as analyzed and designated by the Ministry of Health. The Ghana Health Service shall be in self-quarantine for 14 days. So here's the point. If you traveled from any of these places that we've listed, the United States, the UK, Germany, Norway, South Korea, China, if you traveled from any of these countries, you ought to stay indoors, self-isolate for 14 days. Any individual who has been in close contact with a person confirmed to be having coronavirus disease should be self-quarantined for 14 days since the last contact with the confirmed case. Also, how will I be monitored during self-quarantine? For purposes of self-quarantine, you are required to provide your name, physical address, telephone contact to contact tracing team. So the contact tracing team, that is a team, the government or the health professionals working to contact all those who have come into contact with the person carrying the virus. You ought to make yourself known to them. Let them know that you are self-isolating or you are self-quarantining. Those details will guide their surveillance teams to monitor you whilst you're under self-quarantine, so that if in case you should exhibit any of the symptoms, you would be given the necessary help. Now, do family members or other people I live with also need self-quarantine? And that's the question. It says other members of your household are not required to self-quarantine unless they meet the criteria for self-quarantine as provided by the Ghana Health Service. And you know the criteria as I've gone through already, which is you've come into contact with someone from all these countries that we've mentioned, or you are exhibiting these symptoms. Now, if you develop the signs and symptoms of COVID-19, members of your household may be classified as close contacts depending on your interaction with them, and they will be required to self-quarantine as well. It is therefore important to implement effective self-quarantine. So stay apart from each other for some time, monitor yourself. What should I do for effective self-quarantine? You stay in an airy room away from other people such as family members, preferably with separate bathroom and toilet facilities if you can, or if that is available. If you share the same bathroom and toilet facilities, you have to ensure that you disinfect it after use, using regular household disinfectant or soap and water. The virus won't be able to withstand these. Now, if you're working, what you have to do is stay at home for the entire duration of the quarantine, 14 days from your last contact with the confirmed case is usually what health professionals recommend. Also, you have to ensure that you have adequate food, there is water, you have hygiene provisions, that you have all the toiletries, your hand washing facilities, you have hand sanitizers, all with you when you're self-quarantining. And then you take appropriate medical treatment for existing medical conditions whilst you are in self. So say you are in self-quarantine, you have a medical condition that's already there before this, you make sure that you have all those medications with you whilst you're self-quarantining. Now, you also have to ensure that you have the necessary communication facilities. Example, you have your mobile phone with you, so you'll be able to communicate with your family members and other people who, whilst you are in quarantine. And you also have to always wash your hand with soap and water regularly, or use an alcohol-based hand rub or sanitizer. You ought to cover your nose and your mouth with a single-use tissue when coughing and sneezing. So in these times, you're not advised to use face towels, you're not advised to use handkerchiefs. The best is for you to use a tissue paper, and in that tissue paper you cover your nose, you cover your mouth, you sneeze into it, you hold it together tightly, and you drop it in a bin that is covered, properly covered. Now there it is. You throw away that tissue, immediately you use it into a bin. You wash your hands immediately with soap and water or an alcohol-based hand rub after you've sneezed or coughed. You stay away from pets because you can also transfer it to them. There's a chance that humans can pass the disease to them, to pets, so you stay away from pets as well. And avoid sharing toothbrushes, utensils, dishes, drinks, towels, clothes, bed lining, because the virus can stay in these things for a number of hours. The virus can stay in a toothbrush for a number of hours. It can stay on utensils for a number of hours, in dishes, in drinks. You know, the bottle, the lid, the bottle that you have the drinks in, or the glass, the towels you use to clean, they can all trap the virus, and you can transfer it to someone else. So avoid sharing those things. And what should I do for effective self-quarantine? Again, you clean and disinfect frequently touched surfaces. So if you have a door, your doorknobs, the handles of that door, your bedside tables, your bed frames, bedroom furniture, you ought to disinfect them daily with regular household disinfectant, especially if you don't live alone and you know that other people may have come into contact with it. If you are in an office setting, you know that several people come there, like right here in the studio, we clean all our surfaces, you disinfect all our surfaces regularly. And then if you develop or experience any of these symptoms, you ought to make that call. Now, these symptoms are acute respiratory infection, including fever. If you're coughing, you have a sore throat, if you have a difficulty in breathing, you ought to call for immediate help. And those are the numbers. That's 0509 497700 or 0558 439 868. Those are the numbers. You can just capture it with your mobile phone right now and give them a call if you experience any of these symptoms. Do not walk to a hospital. Do not walk to a clinic if you experience any of these symptoms. Just stay at home, give them a call, and they will come to you wherever you are.